Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to talk today about a specific area of body contouring, and that's fat destruction. And when we talk about fat destruction, there's really a few categories. One of them is liposuction, and liposuction is just like what it sounds like. There's a small incision placed and a very small cannula or tube under high pressure vacuum is placed with lots of local anesthesia, tumescent technique, at least the most common way of doing it. And that suction cannula is passed multiple times in the area where there's unwanted fat. It's evacuated from the body and discarded. That liposuction has been very well described and has been very effective for 2 or 3 decades now, with the last decade showing the most improvement in terms of outcome predictability. The other categories of fat destruction, of course, are non-invasive, and that's where our area of expertise in the Appearance Care Center is doing non-invasive body contouring. And when I categorize that, there's a couple of devices out there. There's the ultrasound that creates heat, the one called liposonics. In our experience and from all the reports, and looking into this very carefully, probably too much discomfort associated with it to make it an effective office-based treatment. There is the cool sculpting device from Zeltiq, which has actually got quite good results in terms of destroying fat, and it does that by applying big suction cups on the abdomen, sucking that tissue in and making it very cold and freezing the fat cells, which are fragile cells. And in the area of the footprint of that suction cup, the fat's gone. Of course, there are areas in between those footprints that can be an issue, which leads us to the newest technology, UltraShape. UltraShape uses ultrasound a lot like the first that I described, but instead of generating heat, UltraShape uses mechanical vibration of the fat cells. This vibration creates what's called the cavitation effect, where the fat cells are separated, and it results in the destruction of about 1/2 to 3/4 of an inch of layer of fat in any area that's distributed. So a commonly asked question that people almost always ask me is, well, if I destroy the fat in this area, does it come back? And the answer is no. We're born with a certain number of fat cells, and that's all the fat cells that we'll ever have. When we get fatter or skinnier, the cells that we do have get bigger or smaller. So there's not more fat cells. The cells that we have are getting bigger. They're made to store fat. And then others ask me, well, if I get it destroyed in one area, won't I get fatter in another area? And the answer to that is basically dependent on your diet and your exercise. If you're going to get fat, yes, those fat cells that are gone are no longer going to get bigger. They're not there, but other areas can still get, those fat cells can expand. And of course, we want to watch, if we're doing body contouring and spending money on improving our shape, we really want to be careful with balancing diet and exercise. Nobody has to go crazy on this part of it, but I think it's important to understand if we're spending our resources on looking better, we ought to include things that we can manage, including body contouring, including our diet, what we're eating, and how much exercise we're doing. So to zone in on this newer area of UltraShape, or the ultrasonic body shaping that is not heat related or not thermal related, UltraShape is a technology new to the US. It does it through vibration. It's completely pain-free and very evenly destroys a layer of fat about 1.5 centimeters. That's a little more than about 3/4 of an inch below the surface. That layer of fat is destroyed evenly, about 1/2 to 3/4 of an inch layer of fat below the surface, and in the area that we can treat. And the general rule is if we can pinch an inch, we can treat that area with UltraShape. UltraShape is a procedure that's done in the office. There's no anesthesia required because there's no pain and there's no discomfort afterwards, so you can go about your business after the treatment. There's no special dressings required, there's no incisions, there's no downtime, and in fact we haven't even seen any kind of bruising with this. The technology, again, is new to the US. We've seen dramatic results in certain patients, we've seen good results in others, but everyone's getting measurable results, particularly when we use objective measures like measuring the circumference of the waist or the thighs or the areas that we're treating. So I would say UltraShape right now is probably the most exciting technology that's, of course, new to the US, and a lot of people haven't even heard a lot about it yet. It effectively destroys fat cells without pain. It does it uniformly. It doesn't do it as dramatically as cool sculpting, but it also doesn't have this sort of bathtub deformity that's the result of where the suction cup goes. And in fact, there may be some synergy between cool sculpting and UltraShape if you want bulk reduction of fat in an area of the footprint of that suction cup and to be able to smooth those edges. Those two technologies might work very effectively together. If you have other questions about UltraShape, I'm very happy to discuss them with you. You can reach out to us at drmaas.com. Leave me a message. If you want to leave some pictures, I can comment on your candidacy for non-invasive versus surgical body contouring. I'm always happy to have questions, photographs, or even video if you want to send them to drmaas.com, or visit our website at maasclinic.com where there's more information. This is Dr. Corey Maas on Looking Your Best.